There's an outbreak of foodborne listeria bacteria. It's claimed the lives of 36 people and infected almost 600 people in South Africa. Our Health Minister Aaron Motsoaledi has warned that newborns and the elderly are particularly vulnerable to listeriosis. The Minister is now with us to unpack. Minister, thank you. We really do appreciate your time.
Thank you, Leanne.
And
thank you to the viewers out there.
It's so important that we do educate our viewers because, like me, I'm learning about listeriosis for perhaps the first time. Maybe I'm embarrassed to admit this, but is it very common? I mean, I haven't heard of this too much in South Africa before.
It has been there for 40 years.
Yeah.
The first time listeria was diagnosed in South Africa is 40 years ago. Every year, our hospitals see between 60 and 80 patients, at least a maximum of 80 patients.
Okay.
It has always been like that for the past 40 years because listeria is wildly, it occurs wildly in nature. It's found in soil, it's found in water, it's found in vegetation. Now, if it can find its way to the food you are going to eat, then you get listeriosis. You are now infected with Listeria monocytogenes, and you are going to get sick. And of course, you might recover or you might perish as it is. But it is treatable. It is fully treatable. And I realized yesterday that some people were confused how 36 people die with a disease that is treatable. There are lots of diseases that are treatable, but still kill a lot of people because they are very virulent. A very simple example is TB. It has been treatable for the past 200 years. But it still kills 1.8 million people around the globe every year. And in South Africa alone, 40,000 people. So I just wanted to explain that a disease can be treatable but still kill if it is virulent enough. And that's what Listeria monocytogenes is.
Yeah. You know, we obviously, and I'm going to personally forgive myself for not knowing too much about listeriosis because it's never really been seen as a notable disease. It's never been flagged because if I'm correct in saying this, you actually don't have previous data of how many people have died from listeriosis before. Before we are reporting now that 36 people have died this year. So your attitudes obviously have to change towards it now.
The data is there, but we have not been collecting it because listeria is not notifiable. You are right.
Yeah.
Yes, a disease is not notifiable at random. It has to qualify by meeting at least 2 of the 5 criteria. In other words, there are 5 criteria set up in the National Health Act and the International Health Regulations of the United Nations. If a disease meets 2 of those 5 criteria, then you notify it, meaning any doctor or nurse or any health worker who come across such a disease is forced by law to report it. There's even a notifying form to write that form and send it. Some diseases are so dangerous, the notifiability must happen within 24 hours. That's category 1, notifiable disease. Category 2, notifiable disease, you can take that time, maybe a week or even a month, but you have got to notify it. Now, listeria did not fall in any of the categories because it was not meeting any 2 of the 5 notifying criteria.
Yeah.
But with this instance now, it has met at least 2 of them immediately. And we are busy in the department making arrangements, which might, I think if I'm not mistaken, we have to gazette it in the government gazette, that now listeria is notifiable and inform all the health workers so that they start notifying it.
Yeah.
Then the question will be, how then did we detect it this time? Yes, anybody can get listeria, Leanne, anybody. But there are groups of people who are particularly and especially vulnerable. These are neonates, newborns in the first 28 days of life. These are pregnant women because when women are pregnant, their immunity is not strong. These are people whose immunity has been compromised by conditions and diseases, like people who are living with AIDS, people who have got diabetes mellitus, people who have got cancer, people who have got chronic kidney or chronic liver disease. They are specifically vulnerable. Now, doctors going around getting listeria, they don't even tell anybody about it, they just treat it. It's treatable with ampicillin. But this year in July, doctors in the neonatal unit of Steve Biko Academic Hospital and Chris Hani Baragarath Academic Hospital, they got worried because they thought they were seeing an increased number of neonates who are coming with the disease. They know that neonates are vulnerable, but they thought the number was more than what they've previously seen. So even if it's not officially notifiable, they then decided to inform the NICD. I will say they were very awake. They were very alive, those doctors.
To be able to do that.
Yes, they informed the NICT, National Institute of Communicable Disease, and said, look, we think what we are seeing is a little bit out of the ordinary. So the NICT then went and said, let us then conduct laboratories and see if any laboratory have diagnosed any cases from January until that time when they were formed. They had to gather that information. Now there's a network of 23 laboratories in the country, private laboratories that are accredited to South African National Accreditation System, which is called SANAS. They had to conduct them and say, from January until now, what data do you have of anybody who presented with listeria? They then conducted the network of the 260 government laboratories under the National Health Laboratory Service and say, please give us data, any blood you have tested for anybody with listeria. Then they brought all that data together. They started developing graphs to see if there is anything that is abnormal. And on the 29th of November, that's last week, they then decided that this data and the graphs means that there's a problem. I mean, then on Monday, they came to inform me.
When we look at the numbers, 345 cases in Gauteng. We've got 71 in the Western Cape and 37 in KwaZulu-Natal. That's just a bit of a breakdown of the cases that we've seen right now. Is it contagious?
No.
Not contagious. So it's something
in fact, being contagious is one of the eligible criteria for notifiability. Listeria is not contagious. What we mean by that is that it's not communicable. It doesn't move from one person to the other. If you get it, the only way I can get it is for you to contaminate the food and I come and ingest that food.
Okay, so it is through food mostly that you get
It's a foodborne disease.
It's a foodborne disease. It is treatable. The things that you must look out for basically is if you are feeling very unwell, diarrhea, nausea.
Well, let me simplify them by classifying them.
Please, and then we'll have to wrap.
Yes, if you get listeria, three things can happen to you. One, you can get the flu-like symptoms. That's what you're describing. Headache, fever, you may get diarrhea, general body pains, weakness, joint pains, vomiting, etc. That's the first group of symptoms. And you might easily recover from that. But you might also get septicemia. Septicemia means your whole bloodstream is now infected. That's very dangerous. You may even end up in the ICU because you are very sick now. You may also get meningoencephalitis, meaning now your brain and the membranes around the brain are infected. There you don't have to ask. You'll feel very sick. You may even have convulsions. You may even go into coma. You may die. So those are the three different things you may get from infection with Listeria monocytogenes.
The reality is seek medical attention. If you have any of those symptoms, seek it because it is curable. You don't have to die from it, although we have seen some deaths this year, particularly in this big jump in this year, 36 deaths, very unfortunate deaths, and we know who it is affecting mostly, and that's the young and the elderly and those that are not well already and their immune systems are down. Minister, we thank you so much for your time and for talking to us here on the program. We'll keep you updated as well as to the developments when it comes to listeriosis.